You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Sternberg Museum of Natural History, also by The Dentist.
Fort Hays State University's Sternberg Museum of Natural History invites you to experience Bringing Fossils to Life, their newest permanent exhibit under the dome. Meet a giant mosasaur and its living little relative, the Australian water monitor. Learn about evolutionary stasis with giant tortoises and discover the many ways fish made their way onto land with mud skippers. Experience all this and more at Fort Hays State University's Sternberg Museum of Natural History in Hays, Kansas.
Discovery under the dome.
Come discover a one-of-a-kind dental center for the whole family at The Dentist. Dr. Melinda Miner and Dr. Michael Holmberg and their warm and friendly staff love working with children of all ages to help keep everyone smile happy and healthy. They recommend children start seeing the dentist by age 1. The Dentist is now accepting new patients, children, and their families. Visit them at 1010 Downing Avenue in Hays or online at thedentistinhays.com.
Hello, and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton, and I'm the coordinator of Early Childhood Grants for USD 489. And with me today, I have two guests. I have Elaine Rupp and Beth Fisher, and they're going to tell us about a program that has to do with special health care needs for our community. And first, I'm going to turn to Elaine, and I'm going to let you tell us a little bit more about the Special Health Care Needs Project.
Well, the Special Health Care Needs Program is a program within the state of Kansas, there's in all counties, that provides or promotes the functional skill of persons who are at risk or who have a disability or a chronic disease. And the program is responsible for developing and promoting the quality of health care directed by the state and federal guidelines. And in our area,
Show us your map.
These are the regions. We are the yellow region. We're the Northwest Satellite Office, and we would be the person that we would call, or individuals would call, if they were interested in this program. And this is the brochure that sort of outlines the program. So you might see this at different locations at your health department or when you're shopping, and you'll know it by the person in the hand. So it's a helping hand for individuals and residents of Kansas who might be experiencing those things. And services include diagnostic evaluations, treatment services, medical equipment, outpatient surgery, hospitalizations. Case management is also available through Navigation for Families. And each application is individually reviewed, and a decision is made according to the guidelines that have been established for income and then also the medical eligibility. Okay. So Kansas infants, children, and adults under the age of 21 with a medical condition could be covered by this program if they meet the income guidelines. And then Kansas residents under, we might think this is just to 21 on this portion, but the other one who may have genetic or metabolic problems that were screened in the newborn screening, they can be covered for life. And these services that are provided would be after insurance, so that would be like if you had private insurance or Medicaid, they could come in and they could be that hand to assist you.
To keep it going.
Exactly.
Now, Elaine, you've talked about some of these things that are covered by your program, but I guess my first question would be, what are some of those conditions, and how would you be eligible?
Okay, well, like Elaine said, the genetic and metabolic conditions, when babies are born or infants are born, they're tested with the heel stick blood spot, and there's like 21 or 27 conditions that those screen for, and if any of those come back, that a child has that, then they're eligible. And those things are like PKU and cystic fibrosis, hemophilia, hypothyroidism, those kinds of things. And then any other medical conditions like congenital heart defects, congestive heart failure, cardiac problems. Anytime there's a craniofacial issue, like if there's cleft lip or palate, hydrocephalus and things like that, and GI problems, if there's surgery that's needed on a child's stomach or their bowels, burns, spina bifida, juvenile rheumatoid arthritis, anytime there's seizures or neurological conditions, if there's vision or hearing problems, orthopedic problems, congenital things like that are all included in that system.
Well, that is a pretty complete list. Lots of different things. I guess if the viewers would probably want to know the cost of these services. Are these services for free? How does this work?
Well, the services that are provided have prior approval to be covered, and then they are cost shared with the individual. And again, this is after insurance or Medicaid. So a family would provide a portion of the cost according to their ability to do that. So, and again, if we remember previously that each application is individually reviewed, so it's not going to be a strain on a family. There's also another provision called a special bequest fund for special requests for medical equipment, specialized services, education, anything that would improve the health or quality of that individual's life that has a special care need. And again, these are things that insurance will not cover or after insurance.
Okay. You mentioned earlier, Elaine, about case management. So, Beth, if you could tell us a little bit more about case management and how that might help a family.
Okay. Once a family has applied for these services, then and they've been established that they are eligible, then a care coordinator is assigned from the program, and that will help them to meet the needs and resources, find the resources for the families. And it'll be things like helping to identify a medical home, plan for transitions, cope with stress, locate support systems, learn advocacy skills, organize and find resources, navigate health care and insurance systems, and increase communication and improve coordination between multiple providers.
That's a mouthful.
Yeah.
Well, it's also a challenge for parents, working with multiple providers. Now, speaking of multiple providers, very quickly, how would this fit in with, I'm thinking young children, early intervention services?
Okay. Early intervention services, from all of those conditions that qualify, most of those children that are identified will also be eligible for early intervention services. And, because the children are at risk for developmental delay. And so we can work with them as well as through children with health care needs.
So everybody works together. Right. I guess the final thing we need to know, if you have a family out there who is interested in maybe learning more about this program, where do they go? Who do they call?
Well, they can call me. Even if they don't live in our service area, I would be happy to direct them to another service provider in the area. And I can be reached at the Children's Center, and the number is 625-3257. I had to think about that for a minute. And then also they can go to the website, which is kdheks.gov/special healthcare needs, and they could fill out an application there. But I'm available because sometimes applications can be a little bit overwhelming, and I would be happy to assist with them.
Sounds like a wonderful program that can help lots of people. Thank you so much, ladies.
Thank you. Thank you.
You've been watching You and Your Young Child, the program devoted to early childhood. Parents, remember, you are your child's first and best teacher. Thank you.
You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Sternberg Museum of Natural History, also by The Dentist.